Asphyxia of newborn, neonatal birth trauma. Asphyxia neonatarum means non-establishment of satisfactory pulmonary respiration at birth. Its literal meaning is absence of pulse. Clinically, it is defined as failure to initiate and maintain spontaneous respiration within 1 minute of birth. Initiation and maintenance of respiration, change in temperature, proprioceptive stimuli, clamping of the heart. Etiology of intrauterine hypoxia, birth trauma to the neonatal, prenatal and antenatal period, medication to the mother. Continuation of intrauterine hypoxia, failure in the placental function, problem in the anatomical separation, extensive infarcts, retroplacental hemorrhage, thin small placenta, circumvallate placenta, hypertensive disorders of pregnancy, supine hypotensive syndrome, cord compression, true knot in cord, vascular anomalies in cord. Continuation of intrauterine hypoxia, maternal hypoxic states when our mother have anemia, eclampsia, cyanotic cardiovascular disorders, status asthmaticus, emphysema, shock, hypertension. Birth trauma, malpresentation, oblicular breach when our newborn have occipito-posterior position, prolonged head compression, malaplated forces, venous extraction, prolonged second stage, contracted pelvis. Birth trauma, increased intracranial tension, cerebral edema and congestion, increased intracranial pressure, asphyxia. Medication in prenatal and antenatal period, we may use morphine, pethidine, anesthetic agents. Clinical features, it depends upon etiology, intensity and duration of oxygen, subsequent acidosis. According to intensity and duration of oxygen lack, we have two clinical features: asphyxia livida, stage of cyanosis, asphyxia pallida, stage of shock. Clinical picture according to degree of depression. Apgar score when we have 4 or 6 ball in named asphyxia livida, primarily a condition of respiratory failure. Apgar score 0 or 3 named asphyxia pallida when combined respiratory and vasomotor failure. In this situation, skin color blue or pale, respiratory movement slow and irregular, and sometimes we have few gaps. Muscular tone gets slowed feebly, heart beats regular rate, reflexes we have cry massa or not reflexes absent. Apgar score, when we have Apgar score 10, we have good newborns. It means his skin total pink, good breath, good heart rate, good muscular tone, and as well as good reflexes. Clinical squamous of birth asphyxia initial responses is hyperpnoea and hypertension, primary apnea, gasping attempted, bradycardia and shock, diminished cerebral flow, blood flow, cerebral hemorrhage, hypoxic ischemic encephalopathy if severe, either this in or handicap if the baby survives. Prophylactica, antenatal detection of high-risk patient, scrupulous fetal monitoring, particularly in high-risk pregnancy, intrapartum use of electronic fetal monitoring, judicious administration of anesthetic agents and depressant drugs during labor. All babies after birth we are signed with Apgar score. Babies with Apgar score 7 or 10 balls, when their color pink, raising regular heart rate, more than 100 per minute, the oropharynx and nasopharynx suction, mucus suction reaccess the condition after 5 minutes. Babies with Apgar score 4 or 6 ball peripheral when our newborns have peripheral cyanosis, breathing irregular, heart rate 100, we need place under a radiant hazer and dry the baby. Baby is put flat or slide head down position, immediately suction. Oxygen administration by bag and mask. Stimulus to back and soul if the above measures fail. Oral suction followed by tracheal intubation. The tracheal tube is connected to resuscitation bag through which oxygen is administered at rate of 6 or 8 liters per minute. If any history of administration at central depression, we may have drugs, naloxone in 16 milligram kilogram intramuscular, or we may have metabolic acidosis. We may use 8.4% sodium bicarbonate, 1 microgram equivalents per kilogram in with 5% dextrose is given through umbilical or peripheral vein. Babies with Apgar score below 4, when our babies have central cyanosis, when our baby is now breathing, heart rate below 100, we need immediate tracheal intubation, lung ventilation, and of course we need use naloxone 10 milligrams per kilogram intravenous. Immediately we used another drugs too when have acidosis and another metabolics change. After severe asphyxia, some our newborns have bad prognosis. There are included cardiovascular failure, renal failure, liver function failure, lungs failure. There are persistent pulmonary hypotensive syndrome in the brain. We have cerebral ischemia and seizures. Birth injuries. Avoidable and unavoidable mechanical and anoxic trauma affects the baby during labor. Predisposing factors include macrosomia, prolonged labor, premature cephalopelvic dislocation, and breech presentation. Some injuries may be latent initially, but later result in severe sequelae. Cranial injuries, saxadenum, is it diffuse, sometimes a hemotic edematous swelling of the soft tissues of the scalp involving the portion present during labor. It may extend across the midline and across the sagittal lines. The edema disappears during its first few days of life. No specific treatment is needed. Cephalohematoma, it is superior cell hemorrhage. It is always limited to the surface one of cranial bone. It does not cross the sagittal lines. No discoloration of the overlying scalp. The swelling starts after several hours after birth. Occasionally, an underlying linear scalp fracture is associated with cephalohematoma. It takes 2 weeks to 3 months to be resorbed. No treatment is needed, but may be phototherapy to ameliorate hyperbilirubinemia. A massive cephalohematoma may rarely result in blood loss severe enough to require transfusion. Fractures to the skull. Linear skull fractures are the most common no symptoms and requires no treatment. Depressive fractures, the use of forceps delivery, it is advisable to elevate severe compression to prevent cortical injury from sustained pressure. Subconjunctival and retinal hemorrhage are frequent. Petechiae of the skin of the head and neck are common. Peripheral nerve injuries. Erb's palsy is an injury to cervical 5 or 6. There is failure of abduction of the arm from the shoulders, inability for external rotation of the arm and to supinate the forearm. The characteristic position is additional rotation of the arm and propagation of the forearm. The biceps and motor reflex absence of one of the effect side. Klumpke's paralysis. Klumpke's paralysis is rare injury to cervicalis 7 and 8 and thoracilis 1. It's produces paralyzed hand and is lateral ptosis and meiosis. If is symptomatic fibers, 2 thoracilis 1 are injured. Phrenic nerve paralysis, when we injure cervicalis 3, 4, 5 injury result in dyspnoea, cyanosis, and irregular breathing. Facial nerve injury. Facial nerve injury results from pressure over the facial nerve in utero from efforts during labor or from forceps during delivery. Rarely it is due to nuclear agenesis of facial nuclei. When the infant cries, there is movement only one of non-paralyzed side of the face, and the mouth is drawn to the side. On the effect side, the forehead is smooth, the eye cannot be closed, then soluble for the liver is ruptured and there is formation is subscapular hematoma which may tamponate further